Welcome to this JAMDA author video presentation. I am Simone, registered nurse, Master of Science and PhD candidate at the University of Maastricht, the Netherlands. I will discuss my article in the August 2018 issue of JAMDA, the Journal of Post-Acute and Long-Term Care Medicine. The article is entitled Prevalence and Risk Factors of Dehydration Among Nursing Home Residents, a systematic review. Dehydration is a condition that results from excessive loss of body water, with or without sodium. Normally, homeostasis ensures a stable and constant hydration status of the body. When dehydration occurs, this homeostasis is disrupted. Older adults are at particular risk for dehydration because of physiological changes due to aging, involving a reduction of total body water, a decreased thirst stimulus, and a progressive reduction of renal function. Frail and disabled nursing home residents not only show these physiological changes, but their risk of dehydration is also increased because of their multimorbidity, disabilities, and polypharmacy. There are two types of dehydration, acute and chronic dehydration. Acute dehydration mostly occurs during acute diseases, while chronic dehydration is associated with a gradual decline in fluid intake because of progressive chronic diseases and disabilities. Dehydration affects the individual's quality of life and is associated with various negative consequences, such as delirium, falls, a high risk of mortality, and reduced quality of life. Additionally, dehydration increases the intensity of medical and nursing care, and nursing home residents are also often hospitalized because of dehydration, making it to an economic burden as well. Despite the relevance of this problem, research about the prevalence and risk factors of dehydration in nursing homes is scarce. There are some systematic literature reviews regarding the prevalence and risk factors for dehydration in older adults, but these studies do not primarily focus on nursing home residents. A better understanding of the prevalence of dehydration and its associated risk factors among nursing home residents may help to create awareness of the size of the problem and may support in developing preventive interventions to optimize quality of care in nursing homes. In this study, we have addressed two research questions. First, what is the prevalence of dehydration among nursing home residents? And second, what are the risk factors for dehydration among nursing home residents? Both research questions were answered by doing a systematic review. For each question, a search strategy was developed, which was entered in the databases PubMed, CINAHL, and Embase. Studies were included if they focus on older adults staying in nursing homes. They also had to contain data on dehydration combined with prevalence rates or risk factors for dehydration. Furthermore, studies were only included if the prevalence rates of dehydration were measured among residents actually residing in a nursing home and not for residents being admitted to the hospital. Lastly, the studies had to be published in Dutch, English, or German. All hits we retrieved were screened on title and abstract by the first and second author. The articles which met the inclusion criteria were retrieved in full text. After final inclusion of the suitable articles, we performed data extraction. The most important extracted data were the prevalence rates and risk factors for dehydration, the type of dehydration, chronic or acute, and the assessment method of dehydration. The methodological quality of the articles was assessed using a validated critical appraisal scale for descriptive studies. 19 articles met the inclusion criteria and were included in the systematic review. These articles were published between 1984 and 2016. The majority had a cross-sectional design and most study participants were female. The methodological quality was diverse, but 68% of the articles had a moderate quality. The prevalence rates of dehydration among nursing home residents varied between 0.8 and 38.5%. A possible explanation for these differences in prevalence rates is that different methods were used to assess dehydration, such as blood tests, urine tests, and various physical symptoms. This makes it difficult to compare the reported prevalence rates. Furthermore, it can be questioned which assessment method is mostly valid and reliable to detect dehydration. Probably care professionals are more aware of acute dehydration in combination with acute diseases than of the possibility of chronic dehydration. When it comes to the risk factors for dehydration, 49 potential risk factors were investigated, of which 12 were assessed in more than one study. It appeared that only 2 factors were significantly associated with dehydration among nursing home residents, namely fever and cognitive impairment. This probably indicates their relevance as factors being associated with respectively acute and chronic dehydration in nursing home residents. However, the methodological quality of most studies was moderate to low, and many of these studies did not specify the type of dehydration, which limits their comparability. Our systematic review confirms that dehydration among nursing home residents is a relevant problem. In addition, we lack a reliable and universally agreed method to assess dehydration in this population. Of the potential risk factors, only fever and cognitive impairment were significantly associated with dehydration in nursing home residents in multiple studies. Several methods are used to diagnose dehydration. It is advisable to first establish a uniform way to measure dehydration among nursing home residents. Currently, we are performing an international Delphi study to gain consensus on a reliable method to assess dehydration. If consensus can be reached about the most preferable method to assess dehydration, a future prevalence study will be performed using this method. Finally, more research is needed on the differences in risk factors per type of dehydration to ensure a correct approach to tackle this problem more adequately and contribute to the quality of life of the nursing home residents. Thank you for listening. For further details, please read the article in the August 2018 issue of JAMDA, the Journal of Post-Acute and Long-Term Care Medicine, which is available at jamda.com.